Let's talk about MALS. So MALS stands for median arcuate ligament syndrome. The median arcuate ligament is an extension of the diaphragm. So it's a muscle or ligament that basically comes off the diaphragm and is lying on top of the celiac artery. The celiac artery is one of the major arteries that comes off the aorta. The aorta is the biggest blood vessel in your body. And the celiac artery is an artery that gives blood supply to your spleen, your stomach, and your liver. If that ligament is too tight, it compresses the celiac artery, which affects the blood supply and leads to the symptoms that you're having. Their symptoms typically include left upper quadrant abdominal pain, postprandial pain. So postprandial pain means pain after eating. And the pain is so bad that patients develop something called cytophobia. Cytophobia is a fear of eating. And that fear of eating typically leads to patients having anywhere between a 10, 20, even up to 50-pound weight loss during the time that they're dealing with this issue. The problem with this is that there's a lot of disease processes that have similar symptoms. And it's not until that $1 million workup has been done that the diagnosis is even thought of. How is it treated? Well, median arcuate ligament syndrome is an anatomic issue which can only be treated today with surgery. And it's a very terrifying operation for some because you're operating on top of 5 major blood vessels, including the aorta, the left gastric artery, which is an artery to the stomach, the celiac artery, the common hepatic artery, which goes to the liver, and the splenic artery, which goes to the spleen. The fact that you're operating on such a high-stake territory makes it intimidating and also a very high-risk operation for the patient. That challenge is really what has driven me, along with some of the most amazing stories of patients regaining their life back, their quality of life after this operation.